Oregon is starting a volunteer contact tracing system. It may be the first of its kind in the U.S. and will require volunteers to take their temperature every day for a year and then report it to researchers. Pat Doris takes a closer look.
Public health researchers in Oregon are preparing to launch something we've never seen on this scale. They want to gather volunteers in every corner of the state from every community, especially minority populations, and convince them to take their temperature every single day for a full year and report that to the researchers. 10,000 of those people will have coronavirus test kits at home.
If you're a household of four, we'll have a thermometer, which has a removable tip that you can share amongst your family. Each individual, we're looking for symptoms in each individual in that household.
Dr. David Bangsberg is with OHSU and the PSU School of Public Health and one of the forces behind the plan. The rough draft of the idea is to have 100,000 volunteers scattered across the state, probably more in the bigger metro areas, but you want to have a wide swath of the state covered. The volunteers will take their own temperature every day, and it will be quickly reported back to OHSU, probably with thermometers connected to the internet, so they'll be able to see virtually in real time, statewide, how everyone is doing. If one or more people suddenly develop a fever, they'll know, and they'll be able to swoop in with a team of specialists to get the person tested, and if it's COVID-19, find all the other people they were in contact with and get them tested too. That way, any new outbreak can be contained quickly before it takes off and becomes widespread. It may well be the first of its kind in the nation.
This is the most important event that we've had in the century. You know, this is an opportunity for people to make a difference, not only for themselves and their household, but for all of Oregon.
Blood thinners may improve the odds of survival for COVID-19 patients with high levels of blood clots. That's according to a new study out of New York. Researchers looked at the records of more than 2,700 patients who were hospitalized with the virus. They found those who took blood thinners had a higher survival rate than those who did not. The difference was even larger for those on ventilators. Scientists say each case should still be evaluated on an individual basis to account for any potential bleeding risks.